Good morning and welcome to Digimed TV. The theme of today's broadcast is mental health and stress management. We have some exciting speakers lined up for you today. I'm still waiting for my first speaker to join me in the studio. That's Douglas Hamandishi. He's going to be talking about his work within mental health. And he's going to be followed by a young lady from Leicester who's also going to talk about the same topic. So whilst we're waiting for Douglas to join us in the studio, perhaps I'd like to show you a few examples of applications, digital medicine applications that are being used for mental health and stress management. They take a variety of different forms. They can include the use of devices like wearable headbands that measure your mental activity, and these can be used to provide feedback to help with stress management. So I'm just going to play a little short example of one such application, which has been designed by a company in the UK called MindPlay. And this application uses a wearable headband that measures your brainwave activity. And through the use of smartphones or a desktop computer, can help you to develop practices which help you to manage stressful situations. A particular example video that I'm going to show you now is based on its use for helping students to deal with the stress of examinations. So this is just a short video clip of MindPlay in action, and it's an application called Go Calm.
MindPlay is the first mind-controlled media player and platform which painlessly connects a user's computer to their mind with dry sensor EEG brainwave technology. Imagine this wearable tech as a Fitbit for the brain. It won't get you fit unless you do the work, but you will be able to monitor the habits that work for or against you. By using Go Calm, the learner will be able to understand and train their levels of calm and focus and how it feels like when they are in the zone. By having this knowledge and understanding of how their mind works, they will be able to recreate that feeling and bring the same level of focus and calm into the classroom and in their exams.
When I have an exam, I'd start to get really nervous when I'm about to go into the exam, because I think it's the pressure as to what I've remembered and what I haven't remembered when I'm revising.
Before an exam I feel scared because when I'm doing revision I don't think I've revised enough about a certain bit, or what bit I've revised won't be on the test.
Just before, I feel really nervous in case I don't get what I want to get for the exam.
You're worried that you're not going to get the right grade that you've got to get, and it's like you put pressure on yourself that you don't really need. I definitely think Go Calm helped because clearing your mind and just focusing on the app and the process of what it's teaching you to do and what it's telling you to do, just clear everything, focus on your breaths, tap each part of your body. It's helping you focus.
Well, I think the Go Calm helped a lot with releasing stress. It helped me relax a lot more than normal. I think this will be really good to use before an exam.
When I tried the Go Calm app, I felt that I was really relaxed afterwards. I feel like if I was going to try that in an exam, I feel like it would have actually calmed us down before going into the exam.
If I was going to an exam, this would definitely calm us down.
Easy to access and it's easy to use. It's a good way of tracking, recording the data of how you're actually feeling.
So that's the Go Calm application. I'm happy to say that we've now been joined in the studio by Karthika Bojan, who's actually our second guest on the program. She's actually got her camera switched off at the moment. So what I'm going to do is introduce her with a short video clip that she supplied me of her Cosma application.
Are you a carer for a person with dementia? Are you concerned on how to behave with your loved ones going through dementia? Are you feeling at a loss of how to connect with them and provide them with the best possible care? Cosma helps people with dementia by stimulating their brain and allowing them to experience a better quality of life. We at Brainberry also understand the many problems faced by the families and loved ones of people with dementia. That is why we developed a continuous monitoring capability within Cosma. Cosma actively monitors their cognitive functions, mood changes, and behavioural fluctuations like sleep habits, eating habits, and daily habits, all of which can be viewed daily. Cosma can also produce a detailed individual report which incorporates psychological assessments to ascertain thought processes. This provides you with the information you need to understand and be able to respond quickly and effectively to changes in both mental and physical abilities. Contact us for more information or visit cosmotherapy.com.
To the Cosma application, and I'm due to have Karthika join me in the studio very shortly to be able to talk about that in person. She has her camera switched off at the moment, so I'm just going to ask if she can hear me, whether she can join me in the studio. If you're available, Karthika, can you join me in the studio? Thank you very much. I can see you now, so I'm going to add you to the stream and say good morning.
Good morning.
My first guest didn't show, I'm afraid, so I'm putting you on the spot by inviting you early into the program. So you are based in Leicester, I believe, Karthika.
Yes.
Although your phone number is a Loughborough phone number. I used to live in Leicester myself, so this is how I know these things. So Karthika, would you like to begin by just introducing yourself and saying a little bit about your background and what motivated you to get involved in studying an application like this?
Okay, sure, yeah. So I'm the founder of Brainberry Limited. And I started this company mainly focusing on dementia because my grandmother had Alzheimer's like 15 years ago. So that was the key driver for the start of the company. So what we developed is a gamification app purely for people with dementia, focusing on each of the early symptoms. The uniqueness of this gamification app, or how it differs from other apps, is two things. It's very personalized to the user, meaning like we have a different portal where carers and family members can upload pictures and stuff based on which the gamification works. That's to stimulate their brain with family members' memory and so and so. And the second main key thing of the app is we are going through clinical trials, continuous clinical trials to prove the efficacy of the Cosma app. And the third thing is we collect scientific parameters of how the gaming is done by each user, and we provide them with cognitive scores on their memory, language problems, and which will help a carer or GP to understand the progression of the disease. But the main aim of these cognitive scores is also to understand whether the Cosma app is helping them to go with their daily life.
That's fascinating. I think one of the challenges, and I share your experience a little bit because my own mother died from dementia. So I saw her go through this progression of being, normal, if you wanted in inverted commas, and then going to a situation. She didn't get full Alzheimer's disease, but so she always recognized me, but she had many of the symptoms common of dementia. So I just like to ask you just to explain a little bit more about the kind of metrics that you use to measure the extent of the dementia within your patients.
Okay, so the term dementia itself is an umbrella term for vascular dementia, Parkinson's, Lewy body, and everything. But the key aspect of our Cosma app design is targeted for people with early and mild stages of dementia. So the main aim is to delay the progression of the disease. And the app itself right now contains like 30 games, each under like 8 modules, so-called reminiscence, which focuses on family members and stuff, meditation, which specifically focuses on anxiety and anger, frustrations, which people might bring, language, visual tools, daily tasks like making a cup of tea or going for a gardening or going for a walk. The aim of each of these games is to see that they can implement it in their real life and prolong the quality of life and independency.
So as I understand it, the application prompts them to carry out different activities, and the way in which they carry out those activities, for example, playing a game, gives you some measure of the progression of dementia. Is that correct?
That's right. So we provide, in the app contains a scoring panel where it talks about long-term memory, short-term memory. It provides you the scores for a carer to understand what's happening to the person. And for example, because it's very personalized, let's say there is a game called Family Tree, right? And the user is able to recognize the relationship and drag and drop a picture of their family members. And let's say if they ignore a particular set of people who came in the near future or who were in the past, that will help us to understand whether the dementia user is able to relate to older years, because some people only remember their dad and mother. They might forget their future relations, which is their daughters and father-in-law or son-in-law. So these kind of things we will be able to analyze where their memory stands. Are they living in their past? Are they living in the present? Are they able to recognize things, which will then help the carer to understand what's going in the person's head, so the care and the communication can be thrown towards what they remember rather than focusing on things that might frustrate them.
Yeah, I understand, and I can see I can see how that would relate to my own experiences with my mother. So you are using these gaming applications not only as a form of diagnostics, but also as a form of exercise for the brain, which helps to limit the onset of dementia. Is that correct?
The beauty of the app is it's not diagnostic, it's purely therapeutic and monitoring. So the design of the app is such that it's aiming to stimulate your mind. So that's why we focus on people with early and mild dementia, where we still have the capacity to stimulate the brain. But let's say when people jump to moderate dementia, the app focuses on the emotional aspect of it rather than the cognitive aspect of it.
Yeah. Okay. So I understand. So can you just explain for those people who are not familiar with the condition of dementia, and you mentioned that it's an umbrella kind of situation, what actually happens in the brain when people have dementia, early dementia?
Okay, so right now in the research, people cannot find what is the cause of dementia. But what really happens with dementia as the disease progresses is your brain cells are dead. So, for example, let's say my frontal lobe of the brain, which is the front part of the region, let's say my brain cells are dead, then there is no communication happening between my different part of the brain to the frontal lobe of the brain, right? Because the cells are dead and the neurons are not firing. Neurons are basically brain cells that fire, which sends signals to the brain parts for doing an activity. So let's say one part of my brain gets damaged. So the other parts of the brain cannot provide communication to that part of the region, and that part of the region becomes more dim. And as the disease progresses, the spread of the dead cells increase to other part of the brain as well, because every part of the brain is interconnected.
Right.
So the
Okay. Yeah, so I understand. I've also heard the term neuroplasticity use it. Can you just explain that for me as well, please?
So our gamification app is purely focused on the science called neuroplasticity. Uh, Neuroplasticity is a science that was developed very recently, like 2 decades ago. What scientists have been able to prove that your brain can physically change and functionally change irrespective of age. That's called neuroplasticity. So, for example, let's say you had stroke and your certain part of the brain is damaged, right? But your brain after rehabilitation will be able to accommodate the same function into the different region of the brain to do the function for you. And there has been studies that have proved your brain can physically change as well. So these are some of the things which capacity of a brain to change and stimulate and provide functions irrespective of the damages in the brain. That's why the idea of stimulation of the brain through cognition is our aim. I mean, through games.
Yeah, I understand, and so it's the human body is a wonderful thing, and when people are disabled, whether it's mentally or physically, the people, if they are determined, the body will help them find different pathways. I'm not explaining myself very clearly, but I guess that's what I've tried to say. Is that basically it?
It is true. I think it's personally true because, like, the more positive you are, the more positive your cells are, which creates a positive environment within your body, even to have a good immune system or to fight all these kind of infections and other stuff. So, yeah, I do agree with you. Yeah.
Okay, good. I'm glad we're agreed on that. So, you just tell me, how long have you been running this company? Because it seems to me that you've developed quite a substantial set of applications, and you've gone quite a long way. So how long has it taken you to get here, and how did you set up these clinical trials, and who did you set them up with?
Okay, so we've been running for last 4 years, and our first clinical trials happened in Greece to understand the emotional aspect of the study. So it was with both MCI, which is mild cognitive impairment patients, which is pre-dementia stage, and also people with early dementia, which includes Alzheimer's and vascular dementia. So with that study, what we found is there was enormous significant decrease in the negative emotions when people played Cosmo. And what was more important was the negative emotions that triggered were completely different for an MCI patient compared to a dementia patient. For example, the guilt factor in MCI came down massively. Whereas when you take the dementia patients, it was fear and anxiety that came down. So
Ah,
these psychological aspects that we could see as the stages of dementia progresses.
okay. So how did you actually set up the clinical trials? So was this a European funded project, or how did that work?
Oh, we were heavily funded by Innovate UK from the
Ah,
UK. Yes, yeah. And our
okay.
second
So
and our second trials is quite a big trials which is running for last 2 years in India, and that was funded by a venture capitalist.
Okay. So, well, I must congratulate you on what you've achieved so far. So, can you tell me about your future plans? How do you see things developing, both for the science and for your company?
Okay, so in regards to science, we'll be continuously going for clinical trials because our aim is to provide a very accurate cognitive scores and emotional bar and measurements so people understand and GPs understand what's happening to the specific user. And the aim is to really delay the progression of the disease. So our clinical trials will be moving towards delaying the progression of the disease angle. But in terms of the company itself, we have launched Cosmo app as a service to people. So we will meet the users on a weekly basis with our therapist, provide them with therapy. We will make them understand the cognitive scores and provide them individualized therapy as per how they play the games or how their stimulation happens in the brain. As far as the company goes, we do have a second product, which is our headset, which measures a brainwave activity while they play the games, which helps us to understand and personalize the gamification depending on the symptoms of specific dementia user.
That's wonderful, and I congratulate you with what you've achieved so far in such a short time, and I thank you for joining me on the program today.
Thank you.
So
It's pleasure.
I hope you'll stay around because we have some interesting people already lined up in the studio with me, including my first guest who arrived a little bit late with some paltry excuse that he didn't read his email. So this is Doug Hamandishi. I'm sorry to embarrass you, Doug, but I feel that I'm entitled to for causing me to panic at the start of the program. So thank you very much, Karthika, for joining me at the moment, and I hope you'll stick around. So, Doug, I'm still going to give you a chance to introduce yourself and redeem yourself. Just so would you begin by just saying a little bit about your background and what your interest in mental health and stress management is?
No, fantastic. So again, apologies for the confusion in the morning. Riveting conversation. Well done for that. Kathita was excellent. The gamification is such a vital part of ensuring engagement in around the mental health challenges. So I was riveted to that conversation. So yeah, I'm Douglas Hamadishe. My background is engineering. I'm a mechatronic engineer by background. I diversified into mental health in 2003 as a clinician. And I've been working in large-scale transformation pieces for the NHS and private sector companies in delivering from patient records, digitizing patient records to mobile apps. I've been basically trying to ensure that clinical staff have the right digital tools in order for them to deliver the best care possible. So that means I wear multiple hats simultaneously. Transformation is a big challenge, but my passion is always to make sure that the end results yields the intended outcomes. And that means staying with projects post-implementation most of the time. So as a clinician, engineer, I think systemically all the time about these challenges that we have in introducing technology. And I'm here to provide as much value as possible. So that's a bit of my background without going into the technical aspects of what I do.
Okay, well, we already have, and this is one of my later guests, is George Kowalski from Orca. I don't know whether you're familiar with Orca, but he is probably somebody that you should get to know and talk to when you are looking at some of your projects. But when we spoke some time ago, setting this up, you explained that you do have a little bit of a background also within mental health. Can you just say something about that?
Sure. And rightfully so, this is Mental Health Week. So I'm a mental health nurse. I'm practicing still, although I'm in informatics. I maintain my registration. I think it's very, very vital that when we're delivering technology in that space, that we have clinicians that are currently practicing, because so many things change all the time in terms of how patients want to engage with services, how the illnesses manifest themselves. So my passion from dementia to young people, particularly young people, CAM services, child and adolescent mental health nursing is my real biggest, focus point, because if you can provide an intervention to young people, you are then enabling them, you're giving them the best chance of being able to find a coping strategy that will mean less cost to the NHS over their whole lifespan. You're reducing the cost of costly interventions because you've mitigated the risk. You're working with the whole family structure. You're dealing with stigmatization and eradicating it because you're helping the family heal itself. So CAMS is, for me, is a very special place for mental health services to focus and target their resources. And that's not to say that adult or learning disabilities or older people's mental health is not important. It's just the unique position we have at a point in time to use technology to really change the outcomes over somebody's lifespan.
Yeah, I agree with you entirely. And DigiMed TV is primarily about preventative healthcare. And I think that coronavirus, even without coronavirus, there's been a definite shift and a definite recognition that we need to focus more on preventative healthcare than the use of technology or other, particularly drug therapies, to cure people. Can you just say a few words about it? Give me your views on the impact of coronavirus on mental health. What kind of problems are we seeing, and are we likely to see as a result of COVID-19?
Okay, very good question. COVID-19 is still with us, and it's going to be with us for many years. People talk a lot about the adjustment from working from home and how that can be stress-inducing. Change, we know, is a big stressor in anybody's lives. So when we're talking about mental health challenges now, is we've had for over the last 10, 15 years, we've had services being stripped of their funding. So there's not a lot of resources out in the community. And COVID was a equalizer in terms of how it affected everybody. Before, the stigma around mental health was, okay, mental health people either are predisposed to an addiction, it's them, but it can't be us. But the whole mental health conversation has been brought into everybody's living room because we're all feeling, sometimes for the first time, this loss of hope, this uncertainty, this despondency. And that can be frightening if you've had no experience of mental health. And especially when your expectations are to be either to be the alpha male, the female head of the house, whatever the case may be, it has turned on its head everything. So I'm seeing people in clinics that are really at their wits' end, who feel there's not been a lot of support from their working environment in around their mental health, support around even their home structure and how to access those services. I think the accessing of the services is so important. I'm more confident and more hopeful now is because when I started my journey in mental health in 2003, medical records were becoming digitized. And I think this is the great leveler in the fact that you can digitize your records, because only when you got the clinical record digitized can you then start introducing parity of esteem. This is where we view mental health in the same light as we view physical health. And to do that, you need good quality data. Data has to be great. And mental health is not something that is visible. The response can be visible, but how it's felt is internalized. So that means for many years, it's a wishy-washy, hard to quantify, hard to find real evidence-based outcomes for anything. So the digitization of the medical records is at least starting the conversation to say we have empirical evidence to support and see certain trends, certain features in individuals make them more likely to have depression, and being able to move that data from silo systems within healthcare and push it out into community services, private organizations, voluntary services. All of these type of aspects will enable, I would say, the NHS to really be able to support the Herculean effort it's going to take to support citizens in and around the COVID pandemic.
I certainly agree with having the right kind of data to support these services. but it also does raise the question, and I'm being devil's advocate here now, so I'm not trying to express my own personal views, but you are bound to have issues to do with data protection and privacy. So have you got any thoughts on how you overcome those sort of challenges?
Yeah, data protection, privacy, these have been barriers that needed to be overcome and addressed, and found out what is it about the privacy that is causing the biggest issue. We know right now that visual consultations, we're doing a visual discussion now, virtual discussion now. These things were unheard of in the NHS for so many years. The technology was there. There were clinicians such as myself who were pushing for virtual consultations so that doctors can engage with their patients on their own terms, in their own environment. But information governance, data protection, all of these things became so heavily skewed that it took a pandemic, it took a life-defining event to change that whole narrative. And because the narrative has been switched, now this form of communication has become now the norm. Okay, so I would say data protection is so important. We have governance around data protection already. It's evolving. Yes, the UK is out of the EU, but we still subscribe at least to some of the tenets of the Data Protection Act that we signed up to while we're in the EU. So these things are issues, but they should never stand in the way of delivering care. As a clinician, my primary directive is to support the patient, to support the individual. And data protection for me is something that I have to consider, but there's a framework in place already to support that. Okay.
Well, I'm grateful for you to able to join us, even if it's a little bit late. I could have another dig at you, excuse me. But it's now time to bring in my next guest, is Lucia Panese. She's got a camera, or she switched the camera on. She's obviously listening to what we're saying. So I'm going to bring Lucia into the studio and say, welcome, Lucia. And say, Doug, please stay with us for the rest of the conversation. We've got George Kowalski from Orca lined up after Lucia, so you may want to see what he has to say, because he's going to be talking about a mental health report and the work that Orca are doing in this area. So thank you for the moment, and I'm now going to have a chat with Lucia. Thank you, Doug. So hello, Lucia.
Hello.
Good morning. I'm glad I can always count on you on being on time anyway. So, Lucia, I'm going to start by way of kind of introduction to play a little video clip that you sent me of the I don't know how it's pronounced, Sustage or Sustage game. So I'm going to just play that now.
Games app designed and developed to train cognitive skills that usually decrease with age. In the main menu, users can select one of two game modes. The challenge mode represents the personalized and prescribed training, consisting of a play session 3 days per week. These games are linked to general recommendations about cognitive training. According to users' performance, all the parameters and difficulty of each game can automatically change in order to adapt them to real users' capabilities and to be more effective from the training point of view. Completing the challenges let the user unlock minutes to play the arcade mode. The arcade mode makes all the cognitive games available to the users, and not only the ones recommended. It should represent the funnier way to approach the games and the training, trying to motivate and engage the user and to increase their compliance. In this area, users can decide how to spend their time, playing all the games or just their favorite ones. In this case, the difficulty level increases constantly according to users' performance, as in the so-called endless games.
Yeah. So that I think you maybe you've got it playing. Have you the YouTube video playing? Because I can hear something in the background.
I saw it playing. Yes.
No, okay. So yeah, I just heard something in the background that sounded like the game was still. So anyway,
No.
no. We had Karthika Bojan from Brainberry on. I don't know whether you heard anything of what she had to say, but she was talking about gamification and particularly dementia patients. They were talking about how you personalize that with images and other memorabilia from the patient's past. Is this part of what's going to be developed within the stage game?
Not really. I know what you're talking about because we had that in a previous project where a sort of game called Rummage Box was designed, where actually a physio can upload pictures from the past of a patient just to stimulate reminiscence of what has been going on years before, or when the patient was a young person, when they got children and so on. No, actually, what the Stage project is trying to do, it's a EU-funded project. It's trying to preserve health and well-being at work, also with the aim, of course, of stimulating productivity. So it's seen both from the angle of the worker and of the business. But so mental health is not the central theme there. But of course, you cannot split the two, because one of the ideas is to deal also with stress management. So to find ways not only to preserve cognitive competencies of each worker, but also to stimulate them to have a very good balance between workloads, but also some rest, for example. So it's a whole system behind the line of a worker, which is actually tackling at yes, giving some balance in the activities and keeping a person healthy, particularly from the cognitive and mental point of view. So it's rather something that you could play probably in your spare time, but which is working on competencies such as attention, memory, and so on. I mean, the typical competencies in neuropsychological work, which tend to try to preserve or at least slow down some potential deterioration in these competencies, which is maybe typically with growing age. So the focus of this project is on elderly workers normally. And the idea is also to try to preserve them as best as possible, to keep them as long as possible working. Because you know that if a person is motivated and is of different aspects, work included, because work also contains levels of socializations, of feeling you can deliver something, you can be of some use, and so on. This is, in a way, keeping away depression and a lot of other negative effects. So this is a bit the focus of the project.
Yeah, I can see that, and I certainly think there's a role and a value in that. All of these things which use gamification in mental health and stimulation also enable us to be able to detect early stage dementia or any deterioration. Is this part of the project? And if it is, for elderly workers, is this a risk for them as far as their employer is concerned? If the employer can see that they're deteriorating, how would that be handled?
Well, this is a very good question, David, actually. It's not the focus of the project, actually, to have this, let me call it, clinical component of early detection. Clearly, if somebody, because of course there are data stored behind, so if there is some deterioration, I think that's a topic for the typical medical management in a company. You know that every company needs to have a doctor appointed that is closely following the health of employees. So I'm not really sure, but I cannot imagine that this means risking something in your employment. I would rather say this should support corrective measures taken in due time. Because clearly what we want to do here is to promote well-being and also to preserve people. I mean, people are the richness of a business. So the idea is not to try and let them go or to make them leave earlier. The idea is rather the opposite. So to keep them as long as possible, also because they represent the memory of a company. Elderly workers have a lot to teach to young workers. So it's always a big disaster when elderly workers leave too early. So actually, there should be, I mean, of course, it depends also on the single business, because you can never prevent them to taking strange decisions. I mean, this is not something that any European project can do, of course. But actually, the idea is the opposite, but rather, again, I say from a business point of view rather than from a clinical point of view. You know, we have been working a little bit more on the clinical side with earlier projects. When we worked really on MCI, elderly MCI patients who had comorbidities, such as, for example, a lack of socialization or malnutrition, sedentariness, and so on. So these kind of people who have already something going on the cognitive side, but also who tend to being depressed and sitting on their sofa on their own, trying to engage them through gamification into some interesting activity. And you might remember we have been carrying out a very interesting study in Singapore with a big sort of care home association who was inviting the elderly people to get out of their homes and to come to a daily center to play the games in tournaments. So they put the people together in teams, and they had to collaborate within the team and compete against other teams, so that they don't feel the frustration potentially of being compared directly to somebody else. And this was a very successful project because through gamification, they were able to make people socialize, to get out of their homes, to get into places where they had also some services which were actually designed for their age and condition. So there's quite a lot you can do also around these solutions.
Yes, I certainly, I really like that idea. And of course, we're a bit restricted at the moment with COVID-19 as far as socialization. But I think this notion of getting people together in peer groups and the use of gamification as a social activity, which is particularly tailored to the target age group, is very useful. And we had Ben Wilkins on one of our earlier broadcasts talking about his project in swimming pools with the use of gamified activities with hydrotherapy. And as he mentioned, one of the biggest benefits is actually that you get people together who look forward to this weekly or daily activity where there were other people doing the same sort of thing, competing against each other, but at the same time improving their physical and mental health, and of course all their sense of well-being. Well, thank you very much for, sorry, did you want to say something else, Lucia?
No, just very quickly, the other side of the coin, because also personnel is very stressed, like physiotherapists and so on. For example, we have, some experience with neurology patients who are very, very difficult patients because they complain a lot and so on. And there's a high level of stress in the therapists that treat these patients. But if you treat these patients with gamification, they look so much forward to doing the exercises and they forget to complain about pain and fatigue that actually we have been told by gamification. So I think this is also a very interesting aspect, and we will definitely look a little bit closer to this with a study.
Well, thank you very much for joining me this morning, and I think that's a superb introduction to bring in George Kowalski now for Orca, and he's going to talk about some work that they've done and a report that they've produced on mental health. Actually, this wasn't deliberately planned, but I think it's this broadcast is very timely because I think we're in Mental Health Week. So I'm going to bring George into the stream now. Say hello, George.
Good morning, David. How are you?
I'm fine, thank you. And thank you once again, Lucia. Please stay with us and hear what George has to say. Thank you.
Thank you, Steve.
So, hi, George.
Good morning.
For those who didn't have the privilege of hearing you on the last broadcast, can I begin by asking you just to introduce yourself, say a little bit about yourself, and also about Orca as an organisation?
Of course, David. Hello, nice to see you again on the channel. My name is George Kowalski. I'm the Business Development Director for Orca. Orca are the organisation for the review of care and health applications. It's our responsibility to ensure that we only allow the best and the safest applications available to the public, to the community, and also to the clinicians. We help government bodies, health providers, and innovators all across the world to make informed decisions on digital health, and also ensure that all the standards that are necessary are actually in place as well. So it's our responsibility during Mental Health Awareness Week to ensure that we do our part. We make sure that we actually get the right information and the right message out there to all the actual public.
So can I just ask you, to me, in my mind, it seems like almost like a kite mark or a CE mark. Is that essentially the basis of an Orca evaluation?
Absolutely, David. If I said to you that currently for mental health alone, there are about 3,857 health and care applications for mental health at this moment in time, and unbelievably, only 32% of those applications actually achieve the Orca accreditation mark. The reason for that being, of course, that we review over 350 individual measures and all the actual relevant major standards that are in place, including, of course, as Douglas said, GDPR, data privacy, data security, clinical assurance, clinical awareness, user experience, and of course, medical device regulations. So when you have a look at the applications which are readily available on the market, you'll find that there are a substantial number of those applications which are just not fit for purpose. They either don't carry the right governance, they don't carry the right trust, and they certainly do not carry the relevant certification that's required at this moment in time.
So can you just say something about the business model for Orca? Where does your money come from? If you're evaluating these, presumably it's not the software developers who are paying you to do that, but you provide other services as well. Could you say just a little bit about that?
Of course, yes. It's our responsibility to review all the health and care applications on the market. We also do re-reviews to ensure that, of course, if the actual score of 65%, which is the accreditation mark, is not achieved, we actually help the developers themselves to achieve that mark by production of reports which tell them where they're going wrong and how they can improve. We are completely independent. We don't work with any app developer. We work with all of them to make sure that the actual libraries that we provide to our organizations contain only those applications which achieve the accreditation mark and achieve that particular standard. So we work with, in the UK, for example, we work with CCGs, we work with NHS trusts, we work with, for example, county councils, universities, and other specific organizations as well. And around the world, we work with, for example, Mental Health Commission in Canada, and across, obviously, the Nordics, Australia, New Zealand. We are working with organizations to ensure that they actually have the right accreditation model in place with regards to providing them the library that they actually need to give them access and awareness to the best applications available on the market.
So they are basically paying you for the provision of these libraries. So it's almost like a subscription service, I presume. That would be the nearest way for me to describe that. Is that?
Yes, the model itself looks at, for example, the population that the actual library would cater for. So, for example, if it's going to be university, it would be the population of the students, the alumni, and the actual staff that work for that university. And then from there, we ensure that not only do all the population have access to that particular library, so they have access to all the applications on that library, but we also ensure that the actual main members of that particular organization, who are regarded as pro account users, have the ability to recommend, or if you like, prescribe the best applications to the end user. So obviously with regards to mental health at this moment in time, with there being over 1 billion people struggling with mental health, and obviously with the World Health Organization saying that by 2030, depression will be the #1 biggest illness in the world, especially now that COVID is taking place. We are looking at the problems that are currently facing our end user. And those problems are that in this particular instance, mental health, whether we like it or not, is a stigma. It's one of those areas where men specifically, especially, and also children, just do not like to talk or even mention that they have mental, or they're aware of mental health problems. So what we found even before COVID-19, but especially during the actual lockdown itself, is that there is this massive move forward to using digital innovations. So what we ensure is that we have this safety net. We ensure that we provide end users with the best digital applications on the market prior to seeing someone face to face. So while they are waiting on the waiting list, which then obviously will give them the assistance they hopefully need to cope and manage their own condition. But then once they have seen the actual end user, once they have seen the clinician, we then have the applications available and aware to the end user to ensure that they continue to self-manage that condition. And those conditions, honestly, David, could be anything, not only from the likes of stress and anxiety and depression, but we're talking about, for example, self-harm, panic attacks, insomnia, eating disorders, bullying, and all sorts of different individual areas. And if you, for example, look at these areas, and if you, for example, look at some of the applications that we are currently combating on the market, they actually go through and they highlight the bad, the actual non-good areas to the end user. And an example of that, a prime example of that, especially during mental health, is that suicide prevention apps are supposed to be designed to assist and guide and help the end user. There are so many suicide prevention apps on the market at this moment in time, which go through and actually identify how suicide takes place, and also places that people have killed themselves. And that's the worst thing you can actually say to someone who is currently not coping with their condition and contemplating suicide. So it's our role, our responsibility to ensure that trust, governance, and only the best apps are made available to those users.
Yeah, I can see the suicide apps are a very good example of the abuse of technology that should be designed to improve care. Now, coming to this report, can you say something about the report and give us an overview of it, and let us know how it can be accessed?
Of course, yes, thank you. We've taken it upon ourselves to produce a number of reports, and they're all available on the ORCHA website, so that's ORCHA website. Effectively, these reports themselves have looked in the past at things such as long COVID, nutrition with regards to the health and the BDA, physiotherapy, and so on. During this week, we have a report, and we also have a webinar, an ORCHA webinar tomorrow as well, with regards to digital and mental health recovery action plans. Now, the report in itself is a great read. It's seriously full of very, very interesting information, and is something that really everybody should have their hands on. We have gone through and we have identified what mental health is, how it is affecting the public around the world now during COVID and prior to COVID as well. We then look at the adoption of digital health, how that is actually working, how we can help, for example, reduce the time people are left without help, how they can self-manage their own conditions. We also have a look at, for example, all the individual areas of how we search and how users are searching for mental health apps. So, for example, During the actual pandemic itself, we have seen a rise of, or an increase of over 200% during lockdown of people looking for mental health solutions. So we've gone through, we've identified within the report those solutions, we've identified those individual conditions, we've identified exactly what's available on the market and how that's done. And we've also looked at the examples of best practice as well. So for example, with regards to national accreditation, what we've looked at is, for example, standardization of quality assessments. We're working with a number of organizations around the world to do that. We have just helped the Mental Health Trust of the Surrey and Borders Partnership NHS Foundation Trust to deal with clinical terms and also other specific solutions for CAMS, for children and adolescent mental health services. And the report itself not only goes through and highlights all this information, but it actually goes through and shows you within the report itself some of the best applications to use for depression, for teen mental health, for sleep, for suicide harm, for anxiety, and for other specific areas as well. And finally, the report itself goes through and actually identifies what is actually next for digital health as well. And as Douglas said, COVID is here, I'm afraid to say. It's not going away anytime soon. And what we have to do is have this mental health recovery action plan where we combat mental health in the community and we ensure that effectively those who are currently suffering are assisted in any way we can possibly help them, to give them, as I mentioned before, the safest and the best applications for mental health on the market.
Yeah, I certainly agree with that strategy and policy 100%. And I think personal health management and enabling and empowering people to take better care of themselves is a key component of that. From a mental health perspective, mental health is clearly different from physical health in the sense that mental health is very often not visible, whereas a physical condition or a disability, a cut or flu or all of these things manifest themselves with clearly defined physical attribute. With mental health, that's just a little bit difficult. Have you got any thoughts on how we can effectively identify these things early enough?
Of course. Yes, I mean, as I mentioned before, mental health is a stigma and people just do not like talking about it. It's unfortunate that at this moment in time, people who are suffering with mental health don't want to talk to their colleagues, friends and family about their condition. It's not obvious because sometimes people hide their conditions. If they're stressed at work, if they're stressed because they're alone at home, it's not a physical attribute. So prior to COVID, for example, the main search areas for our libraries were the areas of diabetes, smoking cessation, health and well-being, exercise, and so on. Now, for example, and especially with the youth as well, who were potentially ignored when COVID lockdown happened, because obviously the elderly were the ones which everybody concentrated on. Now, for example, they're coming to us and saying, we need help. What can we do? We are not aware of which applications are available. And that's because they don't know of the sub-conditions of mental health. The conditions like breathing techniques, meditation, yoga, mindfulness, and all those areas which actually stimulate and help the mind rather than stimulate and simply help the body, which obviously is part of the whole context.
Yeah, I think that's an excellent spot at which to conclude, because we're just about up to time. What I would like to play in closing, I've been sent a video clip of applications which are designed to do that. This company doesn't develop the applications, but what they have created is a projector which can project onto 3 or 4 walls to create mindfulness, helpful or brain stimulation experiences. So I'll conclude with that and say thank you very much for joining me, George. I look forward to seeing you again this afternoon. Thank you.
Thank you so much, David. It's been brilliant to be on the channel. Thank you so much.